pregnant and experiencing pain between your lower back and gluteal area, this could be due to the muscle imbalances that are created around your pelvis and hip during pregnancy, which can then start to irritate your sacroiliac joint or your SI joint. Hi, I'm Peruni from the Physio, and today I'm talking about SI joint pain during pregnancy. So here I have a model of the spine and pelvic girdle, and this is your SI joint between your sacrum and your ilium. And this is your pelvic girdle in which your baby starts to grow. So the SI joint is inherently a very stable joint and only has about 2 to 4 degrees of movement. And its role is to transfer the load between your spine and your lower body and vice versa. So during pregnancy with weight gain, your center of gravity moves forward, which causes your pelvis to move anteriorly, which then increases the curve of your lower back, or your lumbar lordosis increases. And that effectively puts a little bit more stress on your SI joint. And we may have all seen that classic pregnant posture where the spine is a little bit more arched, and that is what puts the stress on your SI joint. The other most common reason for SI joint pain is a sudden increase in hormones during pregnancy. Now, this is entirely normal and actually allows the joints of your pelvic girdle to expand and become more flexible to allow room for your baby to grow within that pelvic girdle. But again, this can put a little more stress on your SI joint and make it more painful. SI joint pain usually occurs between the 18th and 24th week of pregnancy, but it can start much earlier and perhaps last throughout the entire pregnancy. Women most commonly complain of pain with prolonged sitting or standing, and the biggest issue tends to be while sleeping and turning in bed. However, the good news is that SI joint pain can be managed conservatively using a few simple strategies. One of the key points I want to convey is the importance of moving, and moving often and moving well. I know the sudden, sharp pains or the constant dull ache can be very off-putting and even frightening, but gentle movement like walking or changing position regularly is often the key to improving your symptoms. So avoid prolonged periods of sitting, especially on low, soft sofas, and the urge to constantly lie down due to the pain, which can actually exacerbate your symptoms. Try sleeping with a pillow between your knees and ankles to help support your pelvis. Keep the pillow between your knees as you turn in bed, slowly, with your shoulders, hips, and knees in line. An external support belt, which supports the pelvis, back, and stomach, can offload your SI joint and make it much more comfortable for you to move. You can try applying heat on the area using a hot water bottle, or even a hot shower can give you good pain relief. And lastly, gentle exercises for your spine and pelvic area can improve your mobility and strength and reduce your SI joint pain considerably. Try this one at home. Kneeling on all fours, inhale and arch your back as you look up. Then exhale and tuck your tailbone under, drawing your baby up towards your spine as you look down. Repeat this movement gently within a pain-free range. For more specific advice and exercises based on your pain and stage of pregnancy, consult your physiotherapist who can assess your SI joint and discuss the best management strategies for you.